Welcome everyone to Healthcare for All, brought to you by WCANradio.com. This program examines the issues of healthcare for you. Join us now in the studio where the program is in progress.
And we want to welcome you to Healthcare for All. My name is Eric Meadows, but the host of this show is Debbie Silverstein. We want to welcome you into the studio, and why don't you introduce your guest?
Hi, Eric. Thank you very much. We want to thank WCAN for hosting us. Healthcare for All is sponsored by SPAN, Ohio, and we'd also like to invite you to join, to visit our website at www.spanohio.org. Our guest tonight, and we're very happy to have him, is State Representative Mike Foley. And Representative Foley introduced, along with Bob Hagan, the Ohio Health Security Act. And so he's going to tell us about that piece of legislation that's been introduced into the Ohio House.
Thanks, Eric, and thanks, Debbie. I appreciate your allowing me to come on. That's right. Representative Bob Hagan and I have introduced legislation. And I should say that for Representative Hagan, I think this is probably the 10th straight General Assembly that he's introduced healthcare for all legislation, basically. But basically, it's legislation that would set up a single-payer healthcare system in the state of Ohio. It would allow us to kind of get out of the crazy, convoluted, insurance-based, system that doesn't cover Ohioans to the extent that we need people covered, and create a system where that we've got one basic health insurance system that pays for procedures when people get sick and need to go to the hospital, don't have to go through the inefficient, absurd, bureaucratic, crazy practices that health insurance companies make you go through, and that we've got a simple, safe, secure way that funding is available to make sure that if someone needs help to see a doctor or a nurse or get some procedures done, that there's a safe and simple way that is covered through our Healthcare for All system. So we are, we think that this makes sense. There's countries all over the world that have a single payer, healthcare system where you don't have to rely on crazy insurance companies, and it just makes sense. And we've got over 1 million people uninsured in the state of Ohio, and we feel that everyone needs to be covered with health insurance. It's a human right. It's not something that is a privilege, but it's an actual human right, and that Ohio should be in the forefront in this country in kind of leading the charge for a single-payer system.
So you think we have a convoluted system right now?
I think that if you tried, Debbie, you could not develop a more convoluted, crazy, complicated healthcare system. I'm married. I've got 4 kids. I've got twins who are 16, an 18-year-old and a 20-year-old who are at Ohio State right now. And just, kids are kids, right? They break their arms. They do dumb things. They skateboard off the car and stuff like that. I don't know. My kids have never done that, but they end up in the emergency room every once in a while.
Yes.
And it's just I just got to tell you, I've got last month my son got we were in Colorado. He got hurt. We had to go to emergency room, and we had to go figure out the insurance system, which was crazy, and whether we could go out of network and get his stuff covered. We paid. We had to pay money out of pocket. Last month I got, and this is 10 years ago. I'm going to tell you, he was 6 years old. Right? Last month we got a letter from the health insurance company from Colorado saying that. We had overpaid by a couple dollars. They sent us a check for $2.87 or something like this. It was like 10 years old, right?
Yeah.
And so it's just that kind of stuff just drives people nuts. We got a couple bucks back, but most people are getting bills getting letters saying you owe more money, that we didn't cover everything. Or the other thing is, my son Tom broke his leg, I think once, or broke a bone in his leg. We went up to the local hospital. And went to the emergency room. They did a good job. They did a great job getting him through. But I swear to God, we got at least over the next month and a half, we got maybe 7 or 8 different bills for different things from 4 or 5 different entities. And we thought we'd paid everything up front, but then we're getting a bill for going to see the orthopedic doctor, right, which is separate than the emergency room bill that we got. which is separate than, for something else. But then we get a bill for the crutches, a separate bill just for the crutches. Right? So I'm thinking if you tried to devise a more convoluted, crazy system, you couldn't do it. And it just makes no sense.
Well, anytime that you have hospital care, always ask for an itemized bill. You would be surprised at what they're charging you and for what.
Yeah.
When I had an outpatient surgery, they charged me $3,000 for the operating room and $29.95 for the lights.
Yeah. Right.
Okay.
Right.
So it was the clerk there. I had called about something, and she says, "You want an itemized bill? I'll send it to you. You have the right to that." And she kind of goaded me into it, and I thought, man, I'm in the wrong profession. I should be charging things like this too.
But it just speaks to, look, we've got this huge problem with people being uninsured and not having access and not being able to go see a doctor when they need to go see a doctor. They put it off and they go to the emergency room, and that's one whole issue. But the other problem is just this. It's just so frustrating. How do you understand these bills? How do you, I've got constituents who will call me and older folks who just don't know what the heck they're paying for anymore.
Right.
It's just maddening, and it's wrong. It is absolutely wrong. We should have it. Life is complicated enough without having to figure out what you owe United Healthcare or Aetna or someone else, and how much they're making in profit off everything that you're doing.
We've heard that we're supposed to be good healthcare consumers, or smart healthcare consumers, and you're saying that that's not really a possibility?
I think it's impossible. I think that you've got to have a PhD in in accounting or economics to understand just the the billing cycles of health insurance companies, to be honest with you.
Well, I think the other part of that, too, is when you really, really need care, you're not in a position to make, healthcare choices based on being a consumer.
That's right. Which is one of the arguments they make is that, that we should open this up to the market, that, somehow the free market will kind of take care of our healthcare needs. But you're right. Look, if I'm sick, I just need to see a doctor, right? I can't. I'm not going to make a decision about whether Dr. A is better than Dr. B or Dr. C. I just need to go see my doctor, who I may know or I may not know, or just may need to go to the emergency room. There's not much choosing you can do in a situation like that.
No, somebody made the point. If you're being taken to the hospital for acute appendicitis, you don't send out competitive bids.
That's right. You're right.
Well, I have a question to ask.
Sure.
You say that over the years, this bill has been introduced a number of different times. What's been the difficulty in getting it passed?
Well, look, there are insurance companies who have a lot of money and a lot of lobbyists, and they fought tooth and nail, not just in Ohio, but in every state in the country and at the federal level to push down, not even, kind of get bills like this even heard. There's self-interest in the insurance company in keeping the system that we have, and the self-interest is money. The profits in the health insurance companies are just outrageous.
Okay, then what's
25, 20, 30% profit.
Then what is it going to take to make this to happen? I mean, you can only plug along, but so long. Eventually, somebody else is going to have to pick up the baton and keep going with this. But what is it going to take to make this to happen in our children's lifetime?
Well, I think that it just keeps. A lot of it is keep pushing, and a lot of it is that the profit margins are becoming so outrageous. It seems to me, and the nature of the private insurance market is so outrageous that more and more people seem to me that are upset and frankly angry about what's going on. We're seeing that in the Occupy Wall Street movement now,
yes,
right?
Yes.
So my sense is that my hope, I think, is that kind of the folks who are just interested in making money have overreached and are going to continue to overreach because that's all they care about is making money. That's their self-interest. And that as that happens, that regular people who are suffering every day, who are being foreclosed on, who have these high insurance bills, who are unemployed, and can't even get insurance to go see a doctor, are fighting back. And that's what Occupy Wall Street's about. And I think it seems to me incumbent upon politicians like me to take notice of that and help out in ways we can. Bob Hagan has introduced this bill for 20 years now, I think. And at some point this is going to happen. The way it happened in Canada is it started off state by state by province by province by province. I think that's what's going to happen in the United States is that you've got states that Vermont has now got a single payer bill that's passed. California's close, I think. Oregon, I think, is talking about some stuff.
Right.
So I think it's you're looking at this is, I think eventually the chips are going to fall. And it'll happen on a state-by-state basis. We're pushing in Ohio.
Okay.
Well, speaking of politicians, and we want to thank you for taking the stand that you have on this issue, but I spent quite a bit of time down in the State House this spring talking with members of the Senate and members of the House on this bill. It was one state senator from the west side of Cuyahoga County who told me that there was no problem with health care because there weren't piles of dead bodies outside the ER when people couldn't get care.
Well, and so that's a lot of their answer, right? Is that
Yes.
the emergency room is our healthcare system, and that people aren't dying,
Well,
right?
I said there's public health laws that prevent those bodies from piling up there, but they're not there; they're somewhere else.
Right.
And then I was told, well, if you're here about the uninsured, you're barking up the wrong tree. So the uninsured have only themselves to blame, is the attitude.
That's the attitude, unfortunately, and that's the attitude of a lot of my colleagues. I'm hoping that attitude will change. That it's going to take movement building. It's going to take people being angry about this. Look, I'm not a doctor. I can't go fix my kid when he breaks his arm, right? I need to rely on someone else. And as a body politic, which we are in this United States, we're citizens that live in this democracy. It seems to me the sensible thing to do is that when you've got basic things like healthcare, that we should all come together and figure out a system that works, that we share, that we figure out a way we can pay our doctors well, pay our nurses well, but that if someone gets sick, that there should be something there, some system there that exists to serve them. We don't have a system there that exists to serve them now. We've got this convoluted, crazy system that if you get sick and you don't have health insurance, you're not going to go see your primary care physician because you don't have one, right?
Right.
You're going to wait till you get really sick and you're going to end up in the emergency room. If that were the case, look, if that were the case, and unfortunately we're getting this way too, but infrastructure in terms of roads and bridges and sewer system, those are basic things that as a society we need to be paying for and making sure that exist in a sound structural way that is systematic and healthcare is one of those things that as a society we need to be.
So you're saying that we should do healthcare. We should publicly fund health care and make sure everyone is covered and everyone has access as a public good.
It's the common good. It's the public good. Right. Yeah. Yeah. Look, I understand that there's business people out there who want to make profits on commodities or things like that. I don't want to tell someone what what brand of tennis shoes to buy or what brand of car they want to go purchase. Or I'm not trying to destruct. Deconstruct capitalism,
Right.
But there's some things that I think that should not be in the capitalistic system, and it seems to me that healthcare is one of those things. That is that across the board there should be a safe system that exists that everyone has access to.
Okay, we'll be right back after this.
May I help you?
Hi, I'm looking to save on car insurance, but it's got to be right for me.
Well, let's check out the Dave aisle.
Excuse me?
The Dave aisle, where your perfect policy is customized just for you. It's all here. The coverage you want, any discounts you get, all at a great price.
I have an aisle. Why is that guy in my aisle?
That's Steve. He works here.
Okay.
Getting just what you want at the right price. Now that's Progressive. Call or click today.
At JCPenney, you'll find more things that last
Because we put quality first. We feel better.
and look brighter.
With more things made to stand up
More things designed to lie down.
and more things you can count on.
Over,
And over.
and while quality is something we look for first,
Our great values have made us.
a name that lasts.
At eHarmony, you don't scan through thousands of pictures looking for your perfect match. Where's the value in that? We pre-screen each and every member for you to determine your matches based on compatibility. So when you get to that first date, you know you'll have something in common. eHarmony does the matching for you based on who you are at the deepest level. Aren't you curious to see who you'd be matched with? Log on to eHarmony.com, where it's absolutely free to review your matches.
And welcome back to Healthcare for All. If you'd like to become a part of tonight's subject, you can do so by dialing 1-800-921-2204. Again, that's 1-800-921-2204. Or you can send us an email to wcanradio@yahoo.com. Representative Foley, I did want to ask you a question based on a comment that you made, that some of your colleagues have made a statement that it's really the fault of the uninsured for being uninsured. And yet when each of them will look at the economic situation that this country is going through, people have lost their jobs. Companies have actually just left the United States because they found cheaper labor markets overseas. How can they justify a statement like that?
Yeah, well, they can't. Simply put, there is look, you get this strain of thought, especially on the very kind of right wing end of the political spectrum, that everything is individual responsibility. There's kind of this macho lift yourself up by your bootstraps. And if you can't make it, well, it's your own damn fault, right? Mm-hmm. Well, that's just not reality, right?
No, it isn't.
And I remember there's a comment one time that one of these guys said, "I will not allow my son to grow up in a socialist, United States or Ohio," right? And I'm thinking, well, that's pretty funny because you're getting paid by the public to taxpayers. You're driving on public roads to come down here. Your kid went to public, high school and university, right? Mm-hmm. Your water system is provided by the public, right? And the sewer system. Your electricity grid is regulated by the public utilities of Ohio. Look, hey man, if you don't want a socialist United States, then you better go find a farm somewhere out in I don't even know where, Somalia or something. Truly. It's nowhere here, close by here. Mm-hmm. So look, it's a false argument that we live in a country where some things. Look, I get it. Some things you're going to have to rely on your own individual initiative and endeavor and. Mm-hmm. To do stuff, but there's certain things that you just can't do by yourself. I'm not a doctor. You're not a doctor. You can't take care of yourself when you're sick. You have to rely on a system that exists that if someone gets sick, then you need a place to go to get healthy.
Well, they're relying on these same people to put them into office. I mean, that means then when the election time comes around, they take a platform of supporting these people, and yet have they actually publicly made a statement like that and said, hey, listen, it's not our fault if you're uninsured?
No, they don't publicly say that. There's innuendos, Eric. Mm-hmm. I looked through the campaign websites of a lot of people that got elected last November, and their campaign website said that they were going to, number one, create jobs. Mm-hmm. I haven't seen a whole lot of that lately.
That's right.
They were going to defend marriage and family. They were going to be fiscal watchdogs and be careful with public money. And, well, they put gun rights in there, and they were going to improve access to the healthcare system, but they didn't want government-run access. Now, or government-run healthcare. Now, when you look at those things, we can help them out with this bill with everything but their gun rights. Because one of the big threats, if they want to protect marriage and family, one of the big threats is to not be able to take your kid to the doctor when they need it, or to be able to pay those medical bills, to lose your home, to go into bankruptcy. Mm-hmm. And in that, we can help them with the fiscal watchdog part. Because if we had a system in place like this in Ohio, we could save $2 billion each year for public employers.
Now, let me ask you about that. $2 billion for the state. How is that broken down? I mean, when you're looking at 66 or 88 counties here in Ohio, how is that broken down, $2 billion being saved?
Most of that would go to public school districts because we've got over 600 public school districts in the state of Ohio. And in a lot of towns, the public school district is the largest employer. Okay. We've started starving them, which is going to hurt local economies. Senate Bill 5. Issue 2. That was to give the local communities and the school boards the tools to manage more effectively. Well, this bill of Representative Foley's would actually do that. It would actually save those districts millions of dollars. And some of those small, tiny school districts, it doesn't sound like they're saving a lot, but to them, the amount of money that they're saving is a huge chunk of their budget because they're paying through the nose. Schools across Ohio are paying on average 20% of payroll to 21% of payroll for health insurance for their employees. And having collected those figures myself, I did it a year ago, and then I did it, 2 years ago, and I did it last year, and I'm getting ready to update those figures. The difference between the first time I did it and the second time I did it, there was a lot of evidence on those 5-year forecasts that the school districts file every year showing that teachers had taken on a large chunk of their health care benefits. Teachers had given up salary for them. And plus taken on some of those costs. And you can see that in the figures that you get and the changes that are made. But there's still money to be saved. We're talking about 20% of payroll, even at almost 3 times the suggested rate of the Senate bill that is a companion to Representative Foley's. It would still be $1.1 billion to schools. Then you would have the state itself as a public employer that would save money. You would have the counties that would save money. In my county, Portage County, it comes out to about $7 million a year. In a county like Lorain and Cuyahoga especially, the savings are tremendous.
Well, who is not seeing this then? I mean, you put down numbers that can be justified and verified. Who is not seeing this?
Those who don't want to see it.
And those whose self-interest is not in seeing this.
Mm-hmm.
So look, this is a multi-billion-dollar industry, healthcare, right?
Mm-hmm.
And when you've got profit margins that are hitting 25 to 33% with insurance companies, those guys have a lot of power and pull, and that they are in terms of the public debate, they're doing everything possible to squelch this as an alternative. So that's why it's so important that, one is that we introduce this bill and keep pushing and pushing, but it's so important that states like Vermont and California, what they're doing right now, because once you start having the examples out there and the real world life savings that are going to happen because of single payer in Vermont and hopefully in California, then it makes it a lot harder for, public officials and politicians in Ohio and Pennsylvania and Michigan and Indiana and Illinois and to say, hey, that's a crazy idea. That's a crazy radical idea. That'll never work. So we're going to have some good examples, I think. Once kind of the states that are out there doing this now are going to be good at it. I should say this. I used to. The other thing is in terms of saving dollars, right? I used to run. I was the director of the Cleveland Tenants Organization for 10 years, right? And so I bought health insurance for my employees. We had 10 employees, and it was just stuff keep you up at night trying to figure out all right, where's the best deal? And oh my God, my health insurance premiums this year are going up 10%. If they went up 10% for any year, man, that was lucky, I got to tell you.
Okay.
15, 20% sometimes. I was talking to the director who took my place, and they're facing another 20% increase in health insurance premiums this year.
Yeah.
And so what do you do in that situation when you've got the employer who's providing health? We tried as hard as possible not to make our employees pay anything, and so we really worked hard to do that. But at some point we couldn't do that anymore, and companies across the board are saying we cannot afford this, so they're cutting back on benefits. They're making employees pay co-pays and portions of what the monthly premiums are, higher co-pays and all that stuff. And it seems to me that both among business owners who are providing health insurance, employees or regular people who are paying more out of their pocket, and just the greater amount of uninsured, that there's going to be once these systems like Vermont get up and going, and it seems to be a saner situation, that we're going to be in a better place in Ohio to be able to pass bills like this.
Okay.
Well, we're talking about the dollars and cents part of it. The real toll is in the human toll that takes place. The Commonwealth Fund came out with a report. It's a very comprehensive report of our healthcare system in comparison with other industrialized nations.
Okay.
And the Commonwealth report found that up to 84,000 fewer people would die prematurely from causes that could be treated here in the U.S. if we could achieve the mortality rate of the 3 leading countries. Now, here in the U.S., 96 people out for every 100,000 die a premature death, a preventable death.
Okay.
France, it's 55. You're never going to totally get rid of those.
Right.
But we're not even hitting the mark here. France has universal access to health care. We don't. Australia, 57 per 100,000. Italy, 60. Those are the 3 top performing. In all of them, there is universal access to health care. we could, when we're talking about better care, we have a target of 80% of adults who receive recommended screening and preventive tests. That's our target, 80%. We actually achieved that only 51%.
Oh boy, it's depressing.
So this is what we're doing to our people.
Right.
And making it. How do you work when you're sick? How do kids learn when they're sick? They can't.
No.
And we base this primarily on people's financial status. If you are wealthy, then you are deserving of health care. If you're poor, then you're not. Because you can break that down. For those that are under 200% of poverty, only 41% hit that target.
Wow.
So.
Well, look, and the other stuff is just stuff like infant mortality and maternal mortality. So we've got, if you look at us compared to, other countries that have, single payer or socialized healthcare systems, our infant mortality is way higher than theirs. 6.7% of deaths in the first year of 1,000 live births in the United States, compared to 5% in Canada, 4% in Italy, 3% in Sweden, places that have better healthcare access for the moms who are having birth.
Right.
And the same with maternal mortality. So moms who are giving birth, 15 out of every 100,000 births, there's 15 moms dying. In countries like Australia, it's 4%, 4.1% in Germany. So having that access and easy, kind of accessible access to healthcare, especially for pregnant moms, seems to me to be something that just makes absolute sense. That we don't have that. That we've got pregnant moms being who don't have health insurance, so they don't have an easy way to go see a doctor.
Right.
Or kind of conditioned to say, oh, doctor, I'm pregnant, I need to go see a doctor. It's not part of their kind of thinking because they don't have health insurance.
Yeah. Well, Commonwealth also found that when we're talking about access, that 1/3 of the population here in the United States report problems of access to health care because of the costs that are associated with them. And by access, that means that they don't see a doctor when they need one, they don't fill a prescription that they need because of the cost, they don't get the necessary tests or treatments that have been recommended for them. An example, in other countries, in the UK, only 5%. In Canada, 15%, much, much lower. And here, 1/3 of us are reporting problems.
So you're right, Eric. It's why the heck haven't we done this, right?
Yeah. I'm listening
cheaper
to
and
this,
it's better,
and it's
coverage.
depressing to hear the amount of deaths, and actually nobody hears. It's like early on when I was a youngster, and I never heard about Vietnam until I got older and was finally had to register for the draft. Then I became very aware of it, and I'm listening to all of this. I thank God for WCAN being able to provide you with a vehicle to get this out there, but it's really depressing hearing this. These are national figures that you're giving us.
Yes.
These are people that are dying every day.
These
that actually are flying up underneath the radar of healthcare,
right,
and just never even qualify.
And and sometimes people just are unaware. Some people choose to be unaware, but some people just are unaware. And I have to say for myself, if I just looked at my own situation, when I was working full time and I had really good insurance and I was young and healthy and things like that, it worked very well for me because I never used it, and but then when I had a problem and I had to use it, that's when this insurance, this system that we have or non-system that we have, became a problem for me because the insurance company didn't want to pay the bills, and they were denying me treatment and that type of thing. So as long as you're well, you're okay.
Okay, we do have a phone call. Go ahead, caller.
Yeah, hi. My name's Sophia, calling from Cleveland. I was just wondering, how do we get citizens behind this? This sounds good. And what are strategies to approach our legislators? I'll direct this to both on the panel. Thank you.
Debbie, Mike, either one of you.
Well, I guess the first thing is I think we do have a great umbrella organization out there that works on this, that's helped Representative Hagan and I kind of develop this legislation, which is SPAN Ohio, and I think Debbie gave the web address for SPAN. And I believe that throughout the state there are kind of regional kind of chapters of the organization that that are active and pushing and flyering, leafleting, and getting me on programs like this. So,
right.
But Deb, I don't know if you want to kind of go through some of this stuff. And I do want to say that I think it is really important that people yell at legislators like me. Right? They need to do that. They need to say, Foley, Hagan, damn it, why isn't that bill passed yet? To the leadership, Representative Batchelder, Speaker of the House, we need health care across the state, a single-payer system. So we need it. I'm telling you, as a legislator, we need that feedback and people yelling and ranting and raving at us. It's, I'm going to say that one of the unfortunate things about being in the legislature is that you've got 40,000 issues hitting you all the time, right? And a lot of times it's, while this should be just common sense, if there's not a well-organized kind of push on issues like this, then they just get put to the bottom of the barrel. I mean, and I should tell you, I'm a liberal Democrat out of Cleveland, and the Democrats are now in the deep minority in the House right now.
Yes.
And we are, at least from my perspective, we're facing an atrocity a week in terms of kind of craziness that's hitting our inbox in the state legislature. So we're doing guns and bars and drilling in state parks, and we're cutting funds to school boards and in cities, 25% cuts to local government funds, and it's like on an every week basis redistricting. It's just been kind of crazy. So it's why I guess I'm excited about what's going on with kind of Occupy Wall Street and kind of hopefully this movement building from the ground up, and that SPAN is it seems to me a logical culmination of where people should be lending their resources and their voices, because SPAN is really important to making sure that stuff like this is implemented.
Sophia, I would also suggest, since you seem to be interested in this, not just you get involved, but talk to a neighbor, talk to a friend, talk to a coworker. And they might not be receptive at first, but keep putting it in front of them. It's kind of like that box of cereal that they used to put in front of Mikey until he finally decided to take a taste of it one morning and poured himself a bowl. Yeah. You have to keep putting it in front of people. And if they see it often enough, then they'll finally look at it and say, what is this? So keep doing that with your friends, your family, your neighbors. And yes, visit the SPAN website at www.spanohio.org. And if you're from another state besides Ohio, we're talking about Ohio right now, but visit our website also and go to our links page, because if your state has an active group, you will find it on that links page.
Let me ask one question. What do people need to do as far as on the political front? Do they need to make an active effort at alerting the politicians on both the county, the city, state, and federal government levels that this is what they need, adequate health care? And repeat this message and repeat it as many times as possible? How many people do you need to get to do this all the time?
Yeah, I think, I think it needs to be as organized as possible in trying to push for stuff like this. That's why I think SPAN is really important. But look, in a time, and really, we're... at a time when we've got, the disparity in wealth between the rich and the poor is the greatest since the 1920s, when the top 400, the wealthiest people in the United States, earn as much as the bottom 50% of all Americans. That stuff is just crazy, right? And in the time when we've got 46 million people without health insurance in this country. And we've got, we've got this system that's going to take place in 2014. We're going to have health insurance for all, not health care for all. And we don't know what the cost of that's going to be for individuals, right? Yeah. For people. It seems to me that this is, we're at this kind of moment in time where there's, look, the issues are out there. There's raw material for hopefully for good organizers to take advantage of, and to be pushing legislators like me and legislators in the General Assembly of the state of Ohio, saying, look, you guys got to change this. This is wrong. This is absolutely wrong what we're doing here. And that, we cannot have this crazy disparity between rich and poor. We cannot have the fact that, we've got a health insurance system, health care system, health insurance system that doesn't make any sense. Right. We don't have a health care system, right? And that, look, this is, it seems to me that, with just kind of the craziness over the last couple of years, in terms of the politics going all over the place, and people out there who are, right and left and all over the place are kind of angry about what's going on.
Mm-hmm.
This is a moment in time that hopefully folks will take advantage of and yell at us and try to fix this system.
Yeah. And this is part of, the whole Wall Street thing, too, because, people will say, well, I don't want government-run health care. But right now we have Wall Street-run health care because decisions are being made on, what treatments I get and what tests I can have to determine what's wrong based on the profitability of the health insurance company.
That's right.
It was Angela Brawley, the CEO of WellPoint Insurance Company, who said, we will not forsake profitability for membership. Membership meaning the policyholders. We're not going to provide you with health care if it jeopardizes our profits.
That's right. Bottom line is what counts here in America.
Exactly. Right. And the 99% are rising up and saying, no more. We've had enough. And that's the same thing as with health care. We have an email message from Kurt Bateman, the state director of SPAN, Ohio. And he suggests that people take a look at the Healthcare movie. It's a documentary film narrated by Kiefer Sutherland. And you can see a trailer at www.healthcaremovie.net. SPAN is organizing potlucks, and that the regional coordinators and the members of the state council from around the state are going to be organizing potluck dinners where people can come and see this movie. So you can check out and see who your or your regional coordinators are on the SPAN webpage at www.spanohio.org and get involved and find out when that movie is going to be shown.
That's great. Okay. I wanted to go back to just kind of this rich and poor kind of debate too. I just pulled up this chart. This is from 2008, the compensation for the CEOs of all the health insurance companies. So I just think it's fascinating and disturbing, to be frank. But the president of Aetna, Ron Williams, makes his total compensation is $23 million a year, right?
Oh my goodness.
Cigna, the Edward Hanway, makes $25 million a year. HealthNet, Jay Gellert makes, poor guy, he's only making $3.5 million a year, right?
Well, I'd complain if I were him.
Yeah. United Health Group, Stephen Helmsley, $13 million a year. All to run companies that basically try not to give us health care, right? Try to say, say that's not covered, or
right. We want your money, and hopefully we won't have to give you anything for it.
Mm-hmm.
Yeah. It's utterly absurd.
It is. It really is.
Utterly absurd.
Because, this is all that's being offered to the public, Take it or leave it.
Well, and the other thing, too, is right now what we have is an employer-based system. The expectation is that you will get health insurance through your employer. But we're finding more and more companies, and especially the smaller ones that can't provide it because they can't afford it. There was a report that was done recently. It was a survey of small businesses, and they were asked what was the biggest problem to them, and they said it's not taxes and it's not regulations, because those are the two things we want to do to help business, right? Mm-hmm. They said it was a lack of consumer demand and healthcare costs that were hurting them the most. So if we can take care of the healthcare part for them, the consumer demand is something that we have to work on with equalizing the wealth distribution in this country. Mm-hmm. And actually a single-payer bill will do that.
Okay. And we're going to be right back after this.
Most of us look at the world like nothing bad will ever happen. An Allstate agent knows that all too often, it does. And they offer innovative ways to help protect your world. Like accident forgiveness, identity restoration coverage, and life insurance for the unthinkable. These days, you need more than just an insurance agent. You need an Allstate agent, someone who makes it their business to help protect you. That's Allstate, Stan. Are you in good hands?
Bicycle, what are we waiting for? The flowers are blooming, the air is sweet, and Zyrtec starts relieving my allergies 2 hours faster than Claritin. My worst symptoms feel better, indoors and outdoors. With Zyrtec, the fastest 24-hour allergy medicine, I promise not to wait as long to go for our ride. Zyrtec works fast, so I can love the air.
At JCPenney, you'll find more things that last.
Because we put quality first. We feel better.
And look brighter.
With more things made to stand up.
More things designed to lie down.
And more things you can count on.
Over.
And over.
And while quality is something we look for first,
Our great values have made us
a name that lasts.
And welcome back to Healthcare for All. Again, if you'd like to become a part of tonight's subject, you can do so by dialing 1-800-921-2204 or sending us an email to wcanradio@yahoo.com. During our break, I was talking about just how depressing this really is to see that these insurance companies who are supposed to be there for the better good are really just lining their pockets. They're just, it's about making money.
Right.
And it's about denying as many as possible or giving them the least amount of health care.
Well, Eric, you have to consider insurance companies are not in business to provide health care.
I understand that now, yeah.
They're in business to make money. That's what businesses go into business for.
But you know something? They don't promote this on their commercials. They talk about the great coverage that they're going to provide you with, and you can rely on them. Look at the Aflac Doc and Major Medical and you know, how they talk about what they're going to do for you and how they're going to pick up the costs and help you through whatever you're going through.
Yeah, and to be honest, you're crazy if you don't have health insurance in this country because of the cost of medical care.
Well, it's the lesser of two evils. You have to have it or you don't.
Right. You know, a lot of times when we're younger and we're healthier, we think we don't need it until we get into an accident or we do get sick. I mean, I spent 3 weeks in the hospital when I was 20. Wasn't something I planned on doing or anything like that. It can happen. But, you know, medical costs, medical debt, which is a phenomenon that basically the United States and the industrialized world is the only one that experiences. Medical debt counts for 62% of our bankruptcies, personal bankruptcies every year.
Yeah.
And the thing is, even insurance doesn't stop you from that because 75% of those people are insured.
You know, that's true. You know, when I look at like the 80-20% rule, a lot of people can't afford that 20%.
That 20%.
A lot of people can't even afford the co-pays that they have on their medications.
That 20%, that adds up very, very quickly.
It really does.
You know, right now my dad's in an extended care facility doing rehab, and he's beyond the time when it's fully paid, and there's a 20% copay every day. Well, that's $40 a day.
You know, I wanted to switch gears real quick on this. You know, we talked about just kind of the health insurance companies and kind of the gross profits they're making, but look, there's other big. You know, we talked about small business not being able to afford. You know, coverage for their employees. But we've got huge companies out there as well who are not paying health insurance for their employees. So places like Walmart and Target and you know, some of the largest employers in the state. You know, Walmart has I think the last figure I saw was like 12,000 employees in the state of Ohio who do not have health care and who and who are on, you know, and who don't make enough, right? In their salaries. And so we as taxpayers are picking them up. You know, they're on Medicaid basically, or Medicare, right? And same thing with Target, and so, you know, so you've got, you know, kind of the large big guys out there who are trying to game the system as much as possible, who understand that the health insurance premiums, you know, if Walmart would pay this, then they are not going to have the lowest prices anymore, right? And so they're getting out of it and putting the burden back on the rest of us to pay for health insurance for folks who get sick, who are only going to go. By the way, if they get sick, they don't have a primary care physician. They're probably going to end up in the emergency room, right?
That's true.
Which is really expensive. So it's just another kind of element of just how convoluted this system is that you've got the richest companies in the country almost who are passing off their health insurance cost to us.
Right. Well, the companies, some of the big companies do it. But part of that problem is that they have seen their costs rise in that to the point where it's making them non-competitive in a global economy. And, you know, it used to be back in 2003, we looked at it and said that the average employer was paying 12 to 15% of payroll for health care costs. It's now well over 18% for that average. And, you know, as you said, you never knew how much the premium was going to go up. That's one of the biggest problems that businesses have. And when you're looking at schools and public employers, is budgeting for that 5-year out, you know, to determine how much money they're going to have, because they never know.
Right.
If we had that single payer bill, they would know exactly how much their health care costs are going to be.
Right.
Okay.
We have an email here, and this is from Dr. Steve Nissen, a cardiologist. He says, if we can invest in prevention, we can lower health care costs. And we must do that because we can't continue to spend money like drunken sailors on shore leave and expect to be able to care for people. The problems that exist before health care reform are still there. There are Americans who are dying because they don't have access to health care. That is a national shame that we have to correct. We haven't fixed it. Health care reform doesn't fix it. We need to change the system. I don't think health care reform went nearly far enough, and that's the problem.
Well, I think Dr. Steve is absolutely right that the healthcare reform system still relies on insurance companies, right? Insurance companies who make lots of money in profits, have lots of money in overhead, and have a self-interest in making those profits rather than serving people, right?
But that's going to go back to something that Eric said. Those people in Congress that passed this, it was pretty much written by the insurance companies, and they gave them what they wanted, which was the individual mandate. But those people in Congress that passed this, they weren't elected to represent insurance companies. They were elected to represent us, the people. When they followed the corporate donation dollar to campaigns or whatever else, because they were spending, I think the insurance companies, like $1 million a day or week or something like that, lobbying against this bill. But isn't that a violation of the public trust?
Well, we should note that there's some Congress people who, like my Congressman Dennis Kucinich, right? Who've introduced every year a single-payer health care bill, Medicare for All bill type bill. But you're right. I mean, look, there's a common good out there that it seems to me that we elect our politicians to serve, and look, we've got a corrupted political system at this moment. We're big money, and large donors and important lobbyists have an inordinate ability to direct what the the public policies are of this country, and it's absolutely wrong. I mean, obviously, healthcare reform is one of the most important things we can change in this country. But secondly, or almost equally important, is just campaign finance reforms.
Right.
We don't have that. Maybe that's another show. We could do. But just the fact that there's so much money from people who have rich self-interest to look after, and they control such dialogue in this country compared to the 110,000 people who I represent in my district who are working class, poor working class, middle class folks on the west side of Cleveland. It's sickening, and it's it really is a cynical kind of situation it seems that we're in right now in terms of the inordinate power that the truly ultra-rich have in this country.
So on the healthcare issue, we're back on Wall Street now, huh?
Yeah, we're back on Wall Street.
It's all interrelated.
Another thing that the doctor said, preventative health care. Yeah. Our population really needs to be educated for preventative health care. Most people will not go to the doctor unless something's wrong. Those that have the insurance are not going to go unless something's wrong or unless it's a scheduled blood test. That's about it. People just are not going to, or they haven't bought into preventative health care as of yet.
But Eric, we're seeing, average deductibles now are around $1,000, and the whole bill is on you.
Yeah,
you true. Have that health. So what if you have health insurance? You're still going to carry the whole freight.
That's right.
And I don't have it this month because the kids need shoes. School's starting. Down, right? The car broke down, the refrigerator broke, and we need a new one.
Well, I do believe that the doctor is correct about putting together preventative health care. I think if enough people are educated on it, they're going to scream enough to say, hey, I can't do it, but I want to do it.
Right.
I can't do it, but I really do want to do this, but I can't do it. And when they start, making that much noise, enough people start making that much noise, somebody's got to listen. So eventually, somebody has to listen.
Right.
So
I hope you're right, and I really do. I think, look, obviously, healthcare, in the debate we've had over the last 2 years around the healthcare policies are important, and hopefully that we're moving in a direction where we're going to have kind of universal kind of single payer system where profits aren't the motive of how healthcare is done, but care is the motive.
Right.
We've got, and I do want to put a plug in. We've got this bill. Issue 3, we've got 3 issues on the ballot this year in Ohio. Issue 1, Issue 2, Issue 3. I'm telling everyone to be an angry voter and vote no on all 3. Right? But issue 3 is this Ohio's attempt to go in and say that we should not We will not enforce any legislation prior to, I forget what the date is, in 2010. Basically, it would be our kind of stick in the eye to the Obama administration around the Health Care Act. There's a real problem with this bill. It puts into the Constitution language that is really bad in terms of our state being able to do any type of health care reform in the future. So it would affect workers' comp, it would COSI laws, or COBRA laws, I'm sorry. Even some folks have said that divorce proceedings, if there's a husband and wife who are getting divorced and they've got small children, that a judge could not say to one of the spouses that you've got to pay health insurance for your children. Because the legislation says that Ohio will not enact any rules or regulations around health care proceedings in the future. It's really, really bad.
None whatsoever?
Right. It's really bad.
No rules? No regulations?
That's my reading of it, yeah.
No laws?
Yeah.
So that means that like a pharmaceutical company could do whatever they wanted in Ohio? Because there's nothing that's going to regulate them?
Well, I think we've got stuff on the books on pharmaceuticals right
now.
Okay. So after I forget what the date is in 2010, but there's a date in 2010 right before the healthcare legislation passed. So any legislation, so we could basically what the folks are trying to do is say we cannot enforce the mandate, right?
Right.
From the healthcare bill. But the implications of that are that there's all these other areas of law that Ohio engages in the normal course of business about regulating healthcare stuff that we would not be able to engage in anymore, or write rules around. So workers' comp, COBRA, and potentially divorce proceedings.
Okay.
Wow.
Well, yeah, it's ugly.
Very.
So you're saying no on issue 3 then?
No on issue 3, no on issue 2, which I hope folks know about is the attack on public sector workers in the state of Ohio.
Right. So, well, let's see. A little more information for people about health insurance premiums. This is going to open some eyes. Health insurance premiums since 1999 have increased 138%. The workers' contribution to their health insurance premiums have increased 159%. So they're picking up more and more and more of that premium as well as the out-of-pocket costs. Now, workers' earnings have only increased 42%. And overall inflation, 31%. That's where the problem lies.
Okay.
And look, and I should say, at least the polling that I've seen is that people want a change. They want a single-payer system. There was a poll done by the California Nurses Association that shows overwhelmingly that folks by 2 to 1 margin want a change in our healthcare system. Do not want to see an insurance-driven healthcare system, but would like to see a single-payer healthcare system.
Right.
So going back to your kind of earlier questions and frustrations about where people's heads are on this stuff, I think people's heads are there, and it seems to me the work now is kind of organizing that. Getting them to get from this is my opinion to getting them to acting and yelling at guys like me.
Yeah. Okay. Hey, listen, we're coming towards the end of the show, and one of the things I did want to do was to give each of you an opportunity to state how can people get in touch with you. You've given out the website for SPAN Ohio a number of times. Keep doing that. It tends to stick in their consciousness if they hear it enough times. And Representative Foley, you can also give us some pointers on how people can get in touch with their own representatives across the state, to make their voices heard.
Sure.
So either one of you can start.
Well, first of all, you can get in touch with me through the SPAN website at www.spanohio.org. I am a regional coordinator for Region 6, and my contact information is listed on the webpage.
Okay.
Yeah, well, in this, and to get a hold of legislators, it's, I hate to say just go Google us, but that's probably the easiest thing to do. We all have kind of individual email addresses at the state of Ohio under the Ohio House of Representatives. But you should do it. You should, it's important that we hear from you. It's funny, as state legislators, we're kind of in that middle ground where, people know their local council people, they know who their mayor is, and then they know who their congressman and their, the president is, obviously, and we're kind of in the middle of all this stuff. But we're really important. We're that kind of glue between local government and federal government. and we engage in a whole bunch of areas of an activity that is really, really important to people, such as healthcare, and what should be important, such as healthcare. So talking to us is really important. Yelling at us and getting in our ear is really important to us. And when we hear that, I mean, we know that represents a lot of people, because we know that constituents out there don't know us that well, but when they get up the gumption to call us, we know that there's an important issue out there that they're representing other people out there. So we need to hear that.
Okay. I want to thank the both of you for being on tonight's show. And as you know, that every Thursday of every month, we're going to come back with Healthcare for All. Now, we do need for you to make your voices heard. So follow these directions and go ahead.
And I would invite everyone to join me next month, November 17th, when my guests will be Michelle Mahone and Donna Smith from the National Nurses Union. They've been working very hard for single-payer health care, and they're also involved at their Main Street contract and Occupy Wall Street.
And they're great. They're both great.
Okay. So until then, we want to wish everybody a good night.
Thank you for listening, and join us every third Thursday of the month from 8:30 to 9:30 p.m. Eastern Standard Time on Healthcare for All. Until next time, stay healthy.